Be ready 5 seconds.
Thank you for giving me this opportunity to speak on the Pharmacy Amendment Bill. My sincere thanks to our beloved leader for encouraging me at all levels. Sir, with your kind permission, I would like to speak in Telugu now and then. The bill proposes to amend the Principal Act called the Pharmacy Act. As we know, the Principal Act was enacted to curb the unethical pharmacy practice which was in vogue. The bill is a welcome step. This is one more step towards realizing the dream. So, I congratulate the Government of India and the Minister for taking care of all parts of India equally. I would like to highlight two important points of the bill. The bill amends the Principal Act by introducing Section 32. An opportunity will be given to students who were pursuing their courses at the time of introduction of the Reorganization Act. There is a cause of concern regarding biodiversity of Jammu and Kashmir in this regard. With the scheme launched called Jammu and Kashmir Industrial Development Scheme, dozens of companies have come. Now they are trying to do over harvesting in medicinal plants wherein biodiversity of Jammu and Kashmir will be at risk. So, I would like to ask the Minister what is the blueprint of Government of India in this regard? Since this is a very small bill, I would like to take the opportunity to stress on a few points and challenges faced by the pharma industry and pharmacists in particular. The first challenge faced by the pharma industry in India is that nearly 60% of active pharmaceutical ingredients were imported from China. This import dependency needs to be addressed. I request the Minister to let the House know about the blueprint in this regard from Government of India. The second challenge is there is a risk of e-pharmacy. It is a risk. One is lives of the patients in e-pharmacies are at risk. That has to be addressed by a separate legislation by Government of India. Secondly, the risk of e-pharmacy is the privacy of patient data. One important point which we should think as a nation is that the people are calling India as the pharmacy of the world. As a doctor, when I scrutinized all the data from the internet, I noted that we are supplying medicines to nearly 140 countries. The medicines which we are supplying are very cheaply priced. So, in this situation, can we call ourselves as the pharmacy of the world since we are supplying only cheap drugs? We are not supplying quality drugs. We are concentrating more on the quantity rather than on the quality. We concentrated on pharmaceuticals and we neglected pharmacists and pharmacy practice in India. Despite having such good numbers of doctors and good numbers of pharmacists, why are we in a very dismal situation with regard to health indices? Here, I would just mention a few health indices worldwide which are considered to be very important for assessing the quality of healthcare in any country. Sir, it is very sad to note that every day Indians are becoming poor due to poor healthcare services. Every day, nearly 50,000 Indians are becoming bankrupt. Every day, 80 Indians are committing suicide because of health issues. It is very painful to note that Indian patients are suffering silently due to lack of health care. Coming back to the pharmacy situation and healthcare of India, we are facing nearly six challenges. We have never concentrated on pharmacy practice in India. Pharmacists can play a very huge role in healthcare of our country. Though we have a very good number of doctors and pharmacists, yet the indices are low. In that juncture, we can use the services of pharmacists. For example, we can use the services of pharmacists for explaining to the patients, counseling the patients about the mode of drug administration and other points to be taken care of in the recovery period. So, we need to train the teachers, but we do not have appropriate numbers of teachers to train the pharmacy graduates. The pharmacy practice needs to be concentrated upon now. We are training our nurses, we are training our doctors, but we are not training our pharmacy students in medical colleges. So, this area also needs to be taken care of. There is a lack of networking among pharmacy institutions. For example, these days it is an upcoming subject in India. So, we need to have good networking among different pharmacy institutions so that their faculty and the students can be exchanged and the pharmacy practice can be implemented in the shortest possible time in India. Sir, like MBBS, Bachelor of Medicine and Bachelor of Surgery students, we do not have community training programs for pharmacy students. This is being done in many countries, but in India, we are not doing it. Likewise, there is no interaction between the pharmacy students and clinicians at outpatient level or at hospital level. We also need to sensitize our students who are moving abroad looking for good pharmacy jobs. Those who do not know the history cannot create the history. We gradually improved our life expectancy, but life expectancy in Japan is 84 years in comparison to 70 years in India. We have Ayurveda for many generations. Still, our life expectancy is only 70 years. I request the government to take immediate actions in this direction. Good government should provide basic amenities to the public such as health, education, and justice. Though we are far from giving justice, we can provide health and education to our people. I request you to kindly study the schemes that are being implemented by our Chief Minister in our state. You will know how we are progressing in health and education sectors. If such schemes are implemented throughout our country, we will be healthy and prosperous. With this request, I thank my floor leader and our Chief Minister. Thank you for giving me this opportunity.